Atheist Nomads, episode 422. What even is a religious exemption?
The podcast you're about to listen to includes cursing and talking about hoo-haws. Please be advised.
Welcome to another episode of Atheist Nomads. I am Dustin, and joining me is Lauren.
Barely.
But you're here.
I am here for a few minutes anyway.
Hopefully longer, but we'll see.
You're so optimistic.
I try.
Okay. Somebody's got to be.
So the Dustin Off the Degree title, or the episode title, I went with what even is a religious exemption, because anything more specific would increase the chances that it gets flagged by somebody as spreading misinformation, when no, that's not what I'm trying to do at all.
Right, we're
trying to fight misinformation.
You're trying to comment on an interesting social development.
Yes. So, what is the connection between religion and vaccines? Lauren, do you have any guesses?
Okay, so I know that vaccines came about in the 1800s at the same time that there was a lot of religious diversity starting to happen. So I wouldn't be surprised if there were religions that targeted vaccinations as new and evil or something. I don't know.
So the first vaccine, the smallpox vaccine, that was the 1790s.
Yeah.
When that was being developed. And smallpox was a big deal. Religion stayed out of it. There was an anti-vax movement, and that was focused on not smallpox isn't a big deal, but the vaccine is actually making people sick.
Right. That was based off the medical, actual vaccine injury.
Yes.
Where, you got something like a blood-borne disease from dirty needles.
Because the way the smallpox vaccine was being administered at that time was you took a cow who was infected with cowpox town to town and used the lancet to cut people's arms, and you take a bifurcated needle and stick it into the blister on the cow, and then get some of that pus right into the arm and go person to person as you go down the line. So one person's making cuts and the other person is just sticking this bifurcated needle into the cut.
It's so gross. It's like a gruesome fare.
So it was painful. It was bloody. It was messy. The expected outcome was a pretty unpleasant illness of a couple days. And there were cases of entire towns getting infected with stuff like syphilis.
Right.
Where the first person who got stuck had syphilis, and his syphilis got spread to everybody down the line.
Yeah.
So there was grounds for an anti-vaccination movement.
But it was not religious-based.
It wasn't religious-based at all.
For some reason, I got my mind stuck on the 1800s, like late 1800s, like 1860s and after.
That's when it was really picking up steam.
Yeah.
And it was in the 1890s was when there was a Supreme Court case when the city of New York was in the middle of a smallpox outbreak. They mandated that everybody in the city had to get vaccinated.
Right. This was the court that the decision that said that they had every right to do that because it was a
public health emergency. Yeah. That his individual...
For the greater good.
Yeah, that this one guy's individual liberty did not outweigh the risk to everybody else in the city.
Yeah. Not when you're trying to eradicate a disease.
That was prior to the eradication program.
Oh, wow. Okay.
The eradication program didn't even really get started until there was a World Health Organization.
Right. Cool.
So 1800s is also when Christian Science started.
Okay. So Christian Science is definitely one that when you think of religious exemptions, they show up on a list.
Mm-hmm. They are the ones known for having practitioners who go and pray with people who are ill because they don't believe illness is real.
It's all mental illness.
Christian Science is basically a modern Gnostic church where you've got this principle that there is the pure spirit world and the physical evil world. If you are saved, then you are pure spirit, and the physical world isn't real. It doesn't matter. That illness isn't real. That's just the manifestation of sin.
You're just an evil walking flesh bag.
Except they don't believe the flesh bag is even real. That it's an illusion. That the illness is an illusion.
Computer simulation. Gotcha.
And so as such, they believe that if they have faith that illness isn't real, then God will save their souls because that keeps their spirit pure. Whereas if they lose faith, then that will be demonstrated by getting medical help.
Ah, so how well you weather the storm of illness is...
Right.
It doesn't actually... It's not like you actually get better if you pray harder or believe more. Sickness happens. It's just a result of this fake, made-up world anyway.
Right.
Okay.
And if you end up dying of a fake illness, then that just guarantees that, and you didn't get any help from a sinful doctor, that guarantees you go to heaven.
Okay. Which is why people don't take their kids to doctors when they're sick.
Right.
And they have grave cemeteries full of dead children.
Yeah.
Yeah.
Okay.
Okay.
The Followers of Christ in Idaho are a similar group, started
Not actually Christian Science?
Not Christian Science at all.
Oh, okay.
They're more of an offshoot of the LDS Church with some Pentecostal mixing.
Definitely some unholy matrimony there between those two religions.
Yeah, so a little bit Mormon, a little bit Pentecostal, and just like Christian
lot of
Scientists. Yeah, lots of dead babies. Religious exemptions to vaccination.
So what difference is it if they get a fake vaccination for their fake bodies anyway?
That demonstrates they don't trust God because they're relying on science to keep them alive in the physical world.
I mean, I can understand if it's your choice, but once it's mandated, it's just like, oh, well, who cares? At that point, you can't fight it. You wouldn't fight it because it doesn't matter.
Oh, they also all believe that if you do not have a choice, God is responsible for who is in charge, and if the authorities say that you have to do it, you are to comply, and by complying with the law, that's not a failure of your faith, because it's not a willful choice.
Okay.
Keeping it voluntary makes it a willful choice, and they will opt out.
Meaningful.
Yes.
Okay.
Therefore, they have to opt out.
All right.
Religious exemptions to vaccinations and also providing medical care to your children all came about at the same time because of a Christian Scientist in the Nixon administration.
Ew.
He got Richard Nixon to apply pressure on all the states to put in these religious exemptions in a whole bunch of laws, including vaccine requirements and child welfare laws.
Oh, so that's how that all got in there, huh?
In particular, if you want federal money for welfare programs, you have to pass these laws.
Ouch.
Yeah. Now, amazingly, Mississippi and I think it was Vermont never passed the exemption on childhood vaccinations for religion.
No.
And as a result, they had the highest vaccination rates in schools in the country, averaging out at around 97 to 98%.
Wow.
If the only exemption is medical, 97 to 98% of the population will be able to get those vaccines.
That just goes to show how screwed up the religious exemption makes the program.
Religious exemptions, when they were pure, and by that I mean not being abused by people who didn't actually have religious beliefs involved,
looking at you, Karen,
would kick it up to drop it down to about a 95% vaccination rate.
Right, because I mean, how many Catholics and Christian Scientists and whatnots are there?
Well, okay, and Catholics don't have an issue with vaccination. They do, however, have an issue with vaccines that are derived from embryonic stem cells.
Right. Even if they are clones of one set from the 70s.
Yeah. In the case of the COVID vaccines, the Moderna and Pfizer vaccines were tested on human embryonic stem cells early on in testing. The Johnson & Johnson vaccine does involve human stem cells in production.
Oh, the more you know. Dealing.
The Roman Catholic Church has come out and said, and this has been approved by every major body in the Catholic Church and the Pope. So it is the infallible word of God that it is not a moral issue because those abortions were so long ago that by getting the vaccine, you are far enough removed from the sin that happened that you don't need to worry about any moral culpability with it. That doesn't make you a party in that abortion. And also, it is a greater risk to the public good to not get vaccinated. So just get vaccinated.
More babies will die from a COVID-related, backlash from not getting the vaccine than any died contributing to the vaccine.
Yes.
Which none did because they're all cloned.
They're all cloned from abortions in the 70s and 80s.
Yeah.
All right. So, yeah, that covers Catholics. There are a couple random groups that have generally been kind of meh about vaccines, like the Amish and Mennonites and some Pentecostal groups where they're not actively anti-vax. They're just not enthusiastic about anything modern, and vaccines are a little too modern.
And they're not going to go out of their way to get them.
Right. Which is why a few years back when there was a measles outbreak in Missouri's Amish community, there was a big vaccination push because nobody in that community had been vaccinated against measles.
Right.
It wasn't that any were opposed to getting vaccinated against measles. It's just not a thing they do.
Yeah.
Not anti-vax, just...
not pro either. So...
just kind of meh.
They're not going to bring it into their medical clinics or wherever they have if they don't have to.
Yeah. So when you get to the really modern vaccines, you can start with the hepatitis B vaccine. That one involves genetic engineering.
Science!
It's a genetically engineered vaccine. It's pretty freaking awesome. Works great. Stopped a huge outbreak and epidemic that was happening, especially among, unfortunately, seriously affecting healthcare workers and then spreading into schools.
And food.
Yeah, it was bad. It was getting bad. And then the vaccine basically wiped it out. It's not gone, but you don't hear about it much. And I know when I was looking at test results with screening tests like that, positive hepatitis Bs were really rare.
Yeah.
Like way less common than positive hepatitis C or HIV. Really rare. The chickenpox vaccine, nobody had a religious objection to it, but I know a lot of conservatives thought it was silly.
Right, like that discounted all the work that went into it. Whatever.
And also, trying to prevent people getting lifelong infections that will come back when they get cancer or are old.
Yeah, you'd think that with all those old people getting shingles,
yeah,
that they would love to have a vaccine for that.
Which there is a shingles shot vaccine now.
Yes.
Which nobody freaked out about.
Nope.
But you don't need a shingles shot if you can just not get chickenpox in the first place.
Right.
And also, chickenpox isn't harmless.
And that's the thing, is that everybody thinks it's harmless. Oh, yeah, you're down for a couple of weeks. You get some itchy spots, you're fine.
Lifelong scars.
Except for the...
And then there's the small percentage of people for whom it turns into encephalitis or other organ issues, resulting in things like lifelong diabetes because it fries your pancreas.
Yeah, well, fuck those guys. Screw those kids. They're a small percentage.
Yeah.
No, that was exactly why that was developed.
And then there is the HPV vaccine.
Ooh, this is a loaded one.
Initially, it was developed to prevent cervical cancer.
Right, because it's the number one cause of cervical cancer was?
Yes.
At some point?
Basically, it is the cause of cervical cancer.
So, yeah.
There are cases of cervical cancer not involved. When HPV was identified, it was when the pap smears were getting started. Doctors were starting to know that a lot of women were dying of cancer all of a sudden. Like this huge growth in women in their 30s dying of cancer in their reproductive organs. And they finally figured out how to do the pap smear to identify the cells early stage, because the cervical cancer often wouldn't be diagnosed until it had already metastasized into the uterus and bladder and on.
Yeah.
And at which point, you're dead.
Right.
So the pap smear was developed to start screening every woman to catch it before, while it's treatable. Then HPV was identified as the cause of almost all of it.
Huh. Oh, that explains why requirements for the pap smear have gone down.
Yes.
And I guess technically I probably wouldn't need one.
And eventually the pap smear will be only done if you are positive for HPV.
Okay.
That hasn't quite gotten there yet, but it is getting really close to the primary screening
I snuck in there
being
so
an HPV
close.
vaccine.
That was my first freshman year of college, I think, when that was first released. And it was like, well, once you're past a certain age, you can't get it anymore.
Mm-hmm.
And I was turning that age like the next week. They let me have it anyway. So it was, I don't know why they did that.
They did that because the by the age of 35, something like 80% of all people.
It was like 23 when I did it.
Yeah. They eventually upped it to 26.
Or 20, let's see, or 21. They were cutting it off like way early. Like I don't know. Like, but by then the risk of you having had sex and caught it was so high that they didn't bother.
Right. If 80% of people have it, of sexually active adults have it, then the chances of, they eventually put the cutoff at 26, assuming that by that point, your chances of having contracted it is really high.
Yeah. So they didn't even, it's like, okay, I've had one sexual partner who was also a virgin, so we probably don't have it. And they're like, well, I'm like, so give it to me. I'm like, no, don't give me excuses.
Yeah. And they've also found since then, it's also been narrowed down to the genotyping on HPVs. There's the 3 variants that cause the cancers. The rest are benign.
Yeah.
The vaccine helps prevent all of them, which is great. Well, once it started to become required for school, because they wanted everybody to be getting it at 12.
Right, before any kind of sexual activity ever started.
Yep.
Therefore, admitting
that teenagers have sex.
That teenagers have sex, and that in itself is sinful.
And conservative Christians freaked out that was giving teenage girls permission to have sex.
I roll. No, it was giving them permission to not die from cancer in their 30s.
Yeah. Yeah. But I think between the chickenpox vaccine and HPV vaccine, that primed conservatives, especially conservative Christians, to be a little less inclined to be excited about a new vaccine.
Yeah, and it was exciting. I mean,
oh yeah,
the speed that they managed to come up with this vaccine and the stuff that they did to make it. Oh man, it's amazing.
Which brings us to our first news story. We know that the anti-COVID vaccination movement is almost entirely political. There are a lot of pastors that are getting behind it. It's completely political. And the religious connection there, because, did Dustin and Knopf agree on what's the connection between religion and vaccines? And the answer is there isn't.
Oh, right.
Where's the connection? The Pew Research Center.
Political affiliation, anyone?
Did a poll on how religious identification and attendance of church services correlated with how people voted in the 2020 election. They found white evangelical Protestants supported Donald Trump 84 to 15.
Wow.
84% voted for Trump, 15% voted for Biden. That is the single group that they had a large enough sample of in their poll to be statistically meaningful that supported Trump. When you include attending religious services, white evangelical Protestants, it goes up to 85% voting for Trump if they attend religious services more than once a month.
Oh, it goes from 84 to 85?
Yeah.
Okay.
Because most of them go to church at least once a month.
Yeah. Once a week, you're starting to stretch it. But once a month?
Yeah. When you look at white Protestants who are not evangelical, 57% voted for Trump, 43% voted for Biden.
Okay.
That group, the more they attended church, the more likely they were to have voted for Biden. Slightly.
Statistically significant slightly?
If they attended church monthly or more often, it was 51% voted for Trump, 48% for Biden.
Holy crap.
If they attended religious services a few times a year or less, it was 59% who voted for Trump and 40% voted for Biden.
Okay.
And non-evangelical white Protestants, we're talking about Methodists and Episcopalians and Lutherans. We're talking about churches that a lot of them have married gay pastors and bishops. Some even have atheist pastors and bishops, openly atheists.
Right. The more progressively liberal churches.
White Catholics who attend religious services monthly or more voted Trump 63%, 36% for Biden. Catholics who were the Christmas and Easter Catholics were pretty even split.
Okay.
The single group that supported Biden the most were Black Protestants, 91% voting for Biden.
Whoa.
How often they attended church services didn't matter.
Okay. Well, they're not going to vote for the racist.
People of religious faiths that aren't Christian, 64% voted for Biden.
Okay.
The only group to support Biden nearly as much as Black Protestants were atheists and agnostics at 86%. 12% voting for Trump, meaning 2% voted for the Green Party or Libertarian.
Gotta love these breakdowns. I mean, to me, it's all just a bunch of names and numbers. But yeah, no surprises either.
Right. What it shows is that the efforts the Democrats made in 2020 specifically to help make sure that Black Protestants voted paid off.
Which explains why the other party is working so hard to restrict those voting.
Right, trying to make sure that Black people don't vote. Trump's efforts to rile up his base, the white evangelicals, paid off.
Yeah, very successful.
And not only winning over white evangelicals, but other white Protestants and white Catholics. Hispanics and Asians don't show up in this group because there weren't enough included in the survey to be statistically significant.
No.
So that's unfortunate.
Yeah.
Hindus, Buddhists, Jews, Muslims, there weren't enough for anyone to be broken out, but there were enough to include them as a big overarching group.
As their own subset.
Their own subset. Okay. With atheists and agnostics supporting Biden so heavily, one of the takeaways I get from this is Democrats need to be actively actually trying to get atheists and agnostics to vote for them.
I mean, we've been saying that for years, but
we're a big enough demographic.
Yep.
We are lean left enough that encouraging us to vote can sway elections.
Yeah.
And just like Trump's...
Especially if we can get more in office.
Yeah. And
openly.
just like how Trump's efforts to get white evangelicals riled up paid off with other white Protestants, white Christians, if Democrats tried actively to get atheist and agnostic voters to happily support them, it would probably also help with other unaffiliated people like the Nothing in Particular group where 61% voted for Biden, but 35% voted for Trump.
Yeah.
If you can tip that group a little bit,
more power
that would also help. But white Christians, I think they're a lost cause.
There's no saving them?
No.
Wink, wink. Nudge, nudge. All right, I gotta call it.
Thank you for making it halfway.
All right. Love you guys, and I will hopefully be back next week.
Fingers crossed. All right, continuing on solo. For our next story, Daniel Darling was the Senior Vice President of Communication for the National Religious Broadcasters Organization. And he was on MSNBC's Morning Joe to talk about why Christians should get vaccinated against COVID. National Religious Broadcasters promotes religious people in the media speaking and, promoting their faith. So that doesn't seem crazy. And he was specifically working to try to get white evangelicals to get vaccinated. Because of that, he was fired. National Religious Broadcasters theoretically promotes free speech, but has a policy that the debate on the efficacy of vaccines is a legitimate debate and that they need to be neutral on the COVID vaccines and view him encouraging people to get vaccinated as being too partisan. And I kind of get it. I get why they would want their staff and people involved in their organization to be neutral, mostly to keep people representing them spreading misinformation. But in this case, it worked against somebody who was trying to do the right thing. This is ridiculous. It is absolutely stupid. And I really hope Darling can get a better job. Washington Governor Jay Inslee announced a COVID-19 vaccination requirement for everyone who works in a school, including early childhood learning centers, colleges and universities, any school, public or private. In response to that, Catholic Bishop Thomas Daly of Spokane felt the need to issue a statement in response, where he affirmed that each Catholic has the right to decide, their own conscientious rights to determine whether or not they want to get the vaccine, but also said that priests shouldn't be signing any document concerning anybody else's conscience. He went on to affirm the Catholic Church's guidance that vaccination is morally permissible and beneficial for the common good, but felt the need to note that clergy do not, quote, replace one's conscience. He said, quote, while we encourage vaccination, we do not intend on violating the consciences of our Catholic school teachers, nor do we intend on vouching for another person's conscience. If a person has health concerns or moral objections about vaccines, he or she should not be forced into being vaccinated. End quote. He felt the need to... Okay, looking at the statistics we saw earlier, white Catholics heavily supported Trump. So his parishioners that he was writing to and guiding, he knew they would appreciate a wink wink from him on, oh yes, you should absolutely get your vaccine, wink wink. No, that's a bullshit move. He should have kept his mouth shut. There's no benefit in saying, we recommend you get the shot, but nobody should be forced to. That doesn't do anybody any good. That doesn't provide any benefit. All it does is play into the hands of people who are rejecting the vaccine for political reasons. And it's so sad that we've reached a point where vaccines are political, where everything has become politicized. It absolutely sucks. Moving on. Pastor Shane Vaughn used his live stream to declare that COVID vaccines aren't working. And he said, quote, I'm going to tell you that God told me to tell you. They've got variants coming that ain't no vaccine going to work for. This nation is under the judgment of God. And I want to tell you something right now. They're already admitting that the vaccine is alarmingly not working. Alarmingly. They're alarmed at what they're seeing. Do you know why? Because America, you're making a huge mistake. End quote. And then he went on to quote Isaiah and claim that science is Egypt and that Christians are God's people. His claim here, he says that there's variants coming that no vaccine will work for. Nobody is saying that there are definitely variants coming that no vaccine will work for. There are people concerned that future variants, if not enough people get vaccinated, will have an easier time infecting vaccinated people. That doesn't mean the vaccines don't work. That's how science works. That's how evolution works. Adding people getting vaccinated can create a selective pressure on the virus, causing mutations to be selected for that make it more effective at infecting people who have been vaccinated. The Delta variant is more effective at infecting people who have been vaccinated than the other variants and the original strain of the virus. That doesn't mean the vaccines don't work. It's something like 98% of all people hospitalized for COVID right now are unvaccinated. Really makes it look like the vaccine's working. Right now, there is virtually no one in an ICU on a ventilator who's been vaccinated. There's a couple, but a few out of the thousands. Yeah, the vaccine is working. The vaccines are working. Absolutely. they are working. The Delta variant makes it so that the vaccines are less effective at preventing you from getting sick. They are still highly effective at preventing you from being hospitalized or dying. So that's great. That is absolutely great effectiveness. A future variant might take that a step further. Well, fortunately, we have vaccines designed using very modern, very high-tech methodologies where they can be updated quickly. And nobody's saying that the vaccines are going to stop working. What people are saying is there's a decent chance we're going to need boosters to keep up with the mutations and the variants. One of the unfortunate things with that, from a global standpoint, is the more vaccines stay in the rich countries, the fewer are available for poorer countries, which leave the poorer countries as places for the virus to more freely spread and mutate. There is a very legitimate argument for not doing booster shots in rich countries and focus on vaccinating the world. I can also completely understand the logic in keeping boosters for your own country if you can. If you can't get enough of your own people to get vaccinated. It's one of many arguments I have seen when it comes to basically anything related to the pandemic. There's no right answer. There's just the least wrong answer. And what's the least wrong? Protect your people or protect the world? Protecting the world does protect your people. But which should you do? Which should be the focus? From a purely humanistic standpoint, I could easily get behind vaccinate the world. Looking at the realities of how the pandemic is going in the US right now, I can definitely say that when a booster is available to me next month, I'm getting it. And to explain a little more on that, they're expecting boosters to be authorized for 8 months after your second dose of your initial series. I finished that up mid-January as a hospital employee in one of the really early groups. And so that 8-month window for me will be timing almost exactly with when it's expected that the FDA and CDC will start recommending and will be approving emergency use authorization booster shots. And in New York State, the Department of Health Board voted unanimously to implement an emergency authorization of a COVID-19 vaccine mandate for all healthcare workers in the state. Part of the original plan for that was to allow a religious exemption, but that got removed from the final draft that got approved. Now, of course, they're getting protests in New York against vaccine mandates, but we saw that here too in Boise. They picketed outside of the hospital I worked for. A lot of other states are, like Oregon has a personal exemption on vaccines that's been on the books in the state since the 1989, and they've now got an emergency order requiring only allowing for medical and religious exemptions as exemptions for healthcare workers. Idaho doesn't have any limits on that, so at least all the hospitals in the Treasure Valley, the major healthcare organizations in the Treasure Valley are, the Boise metro area, are requiring all employees to get vaccinated unless they have a medical or religious exemption. And more states are getting that, especially now that the Pfizer vaccine is fully approved for adults. And moving back to New York, the Buffalo News did an analysis of the Child Victims Act lawsuits that were filed during New York State's don't get out of jail free window, where the statute of limitations on child sexual abuse was suspended. And they found that over the course of 75 years, and this is just based on the people who filed lawsuits, that over the last 75 years, 230 Catholic priests in the Diocese of Buffalo sexually abused children. According to the Diocese of Buffalo, out of the 2,300 priests they've had in that time period, it's a very small number who have been abusing children, like a really insignificantly small number. Well, that number is actually 10% that we know of. And especially if you're going back 75 years, there are kids that were abused that have died or moved away or forgot about it, suppressed it, decided not to sue. So if there were lawsuits filed against 10% of the priests in that diocese, how high is the actual number? Is it twice that? 3 times that? Like, even if we go as conservative as possible and assume it's just the ones that did get named in lawsuits. All right, 10%. 10% of their organization is abusing children and has been for a very long time. That's really bad. Like, I know like we've joked on the podcast that as far as we can tell, every Catholic priest is abusing children. I've assumed it's probably only 2 or 3%, if even that. That is probably a really small amount. Yeah, apparently it's 10%, at least. At the point that you're at 1 in 10. 1 out of 10 of the leaders of your organization are abusing children. That's an organization that is so fundamentally broken it should no longer exist. 10% that were named. If we go with the assumption that it was a minority of them that got named in lawsuits, then you'd be looking at more like 25 or 30%. And if 1 out of 4 or 1 out of 3 of the leaders in your organization are abusing children, then that guarantees that all of the rest are covering up for it, and that every single priest, bishop, cardinal, and pope should be imprisoned. That's what these numbers mean. It's bad. It's really, really bad. Of interesting note, though, while the majority of the lawsuits involved church leaders, mostly Catholic church leaders, the Boy Scouts deserve a dishonorable mention for being responsible for 15% of the lawsuits. And that story almost makes this next one not seem quite so crazy. The Taliban, now back in power in Afghanistan, have announced a formal ban on coeducation in Afghanistan. They are explicitly prohibiting men from teaching any girls at any school in the country, and generally going to try to prevent girls and boys from being in the same school. As one Afghan journalist, Bashir Ahmad Waq, said, quote, "The move has effectively deprived girls from higher education because universities cannot afford to provide different classes, nor are there enough human resources." So they aren't outright saying that girls can't get education. They've just made it effectively they can't. For a truly crazy one, Robin Bullock self-identifies as a prophet. During an interview with Steve Schultz of Elijah List Ministries, he talked about his personal encounters with God, saying, quote, "I remember one time, I've been to heaven in different throne rooms a few times, and every time I was in a throne room, he has a different," and he said, quote, "I remember one time, I've been to heaven in different throne rooms a few times, and every time I was in a throne room, he has different throne rooms for different things. I watched him create the world one time. It was the most amazing thing you've ever seen," end quote. He also talked about the white throne that he ended at, saying, quote, "It was inside of this cube, like gelatin. It was like clear gelatin, and it went around in a square around him and his whole throne. You could see his hair, you could see the outline of it inside that, and his beard," end quote. He continued on a bit and said, quote, "Inside this cube of gelatin, it was clear, like it was pure energy, it was power," end quote. God is in a cube of gelatin, giant cube of gelatin. Like, was it spinning around? So, like, was it spinning around and all jiggly? Is that what he was saying? Or is he just trying to say it was transparent, like a cube of glass? But no, it was a cube of gelatin. So, only partially transparent and got to be jiggly. Like, God's just spinning around in a jiggly cube. It's just weird. All right, well, we don't have any feedback or any new patrons, but if you want to support the show, you can find out how at atheistnomads.com/donate. And if you want to contact us, you can always use the contact form on the website or shoot us an email at feedback@atheistnomads.com. You can also use the SpeakPipe button on the website. They're all great ways to get in touch with us. We love hearing from our listeners. And with any luck, next week Lauren will be doing better. So until next week, remember, not all those who wander are lost.
Thank you for listening to another episode of Atheist Nomads. You can find show notes and contact information at atheistnomads.com. Follow us on Twitter at Atheist Nomads, and like us on Facebook at facebook.com/atheistnomads. Please subscribe to the show in iTunes, Stitcher, or your podcatcher of choice, and while you're there, feel free to leave us a review. Theme music is courtesy of Sturdy Fred. Until next time, this has been the Atheist Nomads.